Every year I have the gift, I would say, of welcoming our summer threes. And you can just feel the energy and the enthusiasm in that room.
I heard a lot of my friends are in other programs and you're just going to be a glorified nurse's aide, but you really aren't. You don't just follow them around, you participate in the care and they value your opinion.
You don't feel like you're kind of the disease coming into the hospital. You can feel like that sometimes at clinicals.
Everyone's been very warm and welcoming. It's been a good experience. I fit right in.
Mayo Clinic is a magnet hospital, and I believe that has a lot to do with our draw of nursing students.
You always hear of Mayo Clinic. I mean, it's the Mayo Clinic, but actually being here, it's a big eye-opener. I mean, it's an amazing hospital with so many different opportunities that you wouldn't get at a smaller hospital. It's just fascinating what people come here with.
I am on the brain side of a rehab unit.
Mainly it's ENT and plastics.
It's the neurology medical unit.
We're performing chest tube psych care.
I've never worked with oncology patients before.
I've been learning to take care of a lot of different types of patients that are coming out of the OR.
It's been really a great opportunity to see a lot of different surgeries. I open packages, sterile packages, set up the room, help get ready.
From the very beginning, meeting the patient, into the operating room and through every procedure so that she doesn't miss out on any of the experiences that we have.
Andy and I, my clinical coach, we spend the day together.
I was a part of the Summer 3 program about 5 years ago. It was my time to pass down some of the knowledge that I had.
I've been trying to teach her the tips and tricks that it took me 10 years to learn.
My clinical coach has been with me the whole way, kind of showing me and teaching me what to do and what not to do, kind of the tricks of the trade as far as how to get things done the right way.
Laura's been a great coach. She's given me a lot of advice about not just nursing in the operating room, but just as a career in general.
She's willing to teach me. If she doesn't know, she would say, let's find out together.
Mary will sit down with me after she talks with someone. We'll go through the conversation, what she noticed, and she'll ask me what I noticed.
As Sarah says every day, the patients are getting 2 for the price of 1.
Now I feel so much more comfortable going in there and talking with the patient, communicating with them.
When she first started, she was a little bit tentative, and as the weeks have gone on, I see her jumping up when a patient's light goes off.
Not only do I get to observe, I also get to participate in a lot, and the patients really appreciate it.
After doing this for 7 weeks now, I feel pretty confident doing it.
I can't give meds, but in the morning we'll go through the medications, what are they, and then I'll go in there when he gives them, make sure I understand what all the medications are and watch how he's giving them so I can see the RN role with medications. Really all we don't get to do is hand the pill to the patient. What's most important, do you know what the medication does? Do you know how it's going to help the patient, affect the patient? Can you assess what the patient needs afterwards? Which is really essentially what medications are all about.
We're doing a progress review with one of our Summer 3s. We touch on their areas of strength and also assess what areas they have for continued growth, what goals they want to accomplish throughout the summer. Danica identified as a need for continued growth for her was to increase her skills in patient education.
We can kind of identify, okay, during this shift, this activity will be happening, so we can make sure and include them in that.
Whenever she sees something interesting that's happening, not just with our patients, but the other nurses will let me know as well, and I can go in, and when the doctors are doing different procedures in the room, they'll call me in, and I've been able to see those as well.
There's a lot to do. It seems like there's always things going on, and they have a lot of biking trails. And there's the volleyball court out there. There's always people getting a game started.
And then there's the Twins games up in the cities, and so that's just a quick shot up there, and so it's been a lot of fun stuff to do.
It was an event for the Summer 3s, and everybody came, and it was a dinner, and then there was swimming and ice skating and basketball.
Everybody's really friendly, and I think everybody here wants to get to know others around them, so it makes it easy to fit in and find new friends.
I couldn't ask to be treated better as a nurse. We're part of the healthcare team. We're treated as equals.
The doctors treat us with a lot of respect. They look at you like you're a nurse, and they ask you questions, and you feel appreciated when you can answer those questions.
If there's anything nice you want to say about Summer 3s.
No, I don't like any of them. I'm kidding. We're fortunate enough to have Summer 3s both on the floor and in the operating rooms.
They assist in patient care, assist with rounds, have excellent ideas, and are encouraged to share those daily.
I feel like everyone around here, the main focus is what does the patient need, and then that's what's most important with our cares.
Towards the end of that 5th day, my husband developed complications and he swelled up and he became blinded. His eyes swelled shut, and I didn't want to leave him alone at night, but I also needed my rest. And Matt volunteered to stay in his room with him all night. As a summer 3, he's just been awesome. His bedside manner and his professionalism, his knowledge, he's just been great.
I was a summer 3, and that was one of the most important experiences in building my future career.
Being a summer 3 started my career here at the Mayo Clinic, and now I'm here working as a nurse and learning more every day.
I heard back from them at the end of my summer 3, in fact, that they would love to have me there. So I was really pleased with that. I was able to know that I had a position coming back during my whole senior year in school, which was an incredible relief to know right where I was going to be.
If I were given the opportunity to come back to Mayo after graduation, I would definitely come back. It's just a great place to work.
I really think this is the place for me.
It's just such a great hospital, and the benefits that they offer and the relationships that you form with people already. I mean, why wouldn't somebody want to come back to Mayo Clinic?
One nurse told me that Mayo doesn't make it hard to come, they make it hard to leave.
I think she's going to make a wonderful nurse, and I think this experience has really helped her to do that. It's really helped her to build on those skills from nursing school and apply them in a practical setting.
It's been a great experience for me. I've learned a lot.
I love everything that's going on here.
It's been a really awesome learning experience.
Each nurse here has a really good heart. They really love nursing, and that's what I observed here.
I have lots of experiences with patients that I left just feeling rewarded and feeling like it impacted their life, and I've made their stay better here and would be someone that they remembered when they left, and that's really an awesome experience.